Chairman. Ms. Strouse, we often talk of ERISA preemption as being important for large employers to avoid the complexity of dealing with a patchwork of different insurance regulations across state lines. Why is ERISA preemption also important for small employers?
Yeah, that's a great question. Again, it comes down to being treated equally. So small employers are already at a disadvantage. So offering them plans that are regulated by ERISA, like the self-funded plans, those are just crucial. It's just another option, another opportunity for them, again, to be innovative. So we don't want regulations to get in the way when something's working, which ERISA has worked for a long time.
Thank you very much. Ms. Strouse, last Congress, the House passed the Lower Cost, More Transparency Act, which, among other things, would have required hospitals and insurance companies to publicly list the prices they charge patients. How would additional price transparency allow agents in the benefits industry like you to better assist employers and employees as they make healthcare coverage decisions?
Transparency is vital. I think we all can agree on that. And right now, the healthcare system has gotten so complicated that it makes it very hard for people to actually be able to manage their healthcare journey. And so PBMs continue to get brought up, and I will tell you, it's not only PBMs in the pharmacy space. There's quite a few stakeholders that actually impact pharmacy costs. So we need to make sure that we're not only targeting one situation and asking for them to be transparent. We need transparency across the board. So when we look at things like site-neutral payments, those are the things that we're looking at in that space as far as the hospitals and all of the consolidation that's happened in the rural communities across the country.
You know, it's intriguing to me that there is this battle not to have transparency, price transparency. Obviously, we must be on to something if the people who should be giving us transparency are not giving us transparency, because it's the right thing to do. Ms. Shields, as you mentioned in your testimony, you were responsible for setting up the Association Health Plan for the realtors. Can you discuss in more detail the participation in the AHP you set up? And how did this participation compare to the participation in ACA plans?
Thank you for that question. Our members were participating in the ACA. We had many that were not insured at all, and then we had many members that were getting their insurance from their spouses, if that person happened to be working. And of course, we did have some on Medicare or Medicaid. When we offered the plan, we had done many, many surveys, and this is something that was a benefit that our members had asked us to offer to them. So when we set up the plan, we didn't find that it took away necessarily from the ACA. What we found is it was a choice that our members were able to look at to see if it was a benefit for them and their family. And so we did have a lot that came to our program because they found that it was either saving them money, it was a better deductible rate for them, or they were able to have a pre-existing condition that was covered, or they were able to keep their doctors, or for any other number of reasons. The problem that we found, back to Mr. Scott's point with the ACA, was that the ones that were in there with a realtor, we were talking earlier about people that are unemployed. Well, if you know a realtor, they're going to tell you they're unemployed every day. They have to get up every day and go find their work. And with that, you might have an average price or an average income that they make, but it's not necessarily something they're going to keep year after year after year. They don't get raises like an employee does. So what happens is that their income is fluctuated. The subsidies, we were being told, is that they would take a subsidy maybe and then end up having to pay it back at the end of the year. So they don't necessarily always qualify for those subsidies. So the cost of the ACA did not always fit them with the lower cost.
Well, thank you very much. I think you've done a great job of describing that situation with realtors from ones I've talked to. Mr. Chairman, I have a question for Mr. Coleman that I'll enter into the record.
Thank you. The